Good afternoon, everyone, and thank you for joining us today for our webinar about current care management IT market trends. In this webinar, lead care management analyst Matthew Guldin will share some of the key highlights from our upcoming report on this topic. You can download the slides from the handout section of your GoToWebinar control panel, and feel free to submit questions throughout the webinar, which we will get to at the end during the Q&A time period. We will share the link to purchase this report with everyone once it is available, though advanced copies are available for purchase at a discount. Our team here at Chilmark Research is united by the belief that effective deployment and use of IT is essential to modernizing care delivery and ultimately improving the patient journey to health. Understanding the emerging trends and technologies to enable this is what drives our choice of research topics each year. It is our goal to provide objective, forward-thinking insights that will help create an informed market of stakeholders that can truly impact our care delivery system. Today's speaker is Matt Guldin, the lead analyst for our care management coverage domain. Matt has been with the company for many years now, actually playing a major role in the writing of our first ever HIE market trends report in 2010. Before joining the team, he worked with such major industry brands as Lumeris, Thomson Reuters, and Siemens. From my own experiences working with him, Matt has a voracious appetite for knowledge and an uncanny ability to retain a huge percentage of what he learns. You'll be in good hands today. Before I pass this over, it is with great pleasure that I am announcing publicly for the first time that we'll be hosting the inaugural two-day Chilmark Research Conference in early fall on October 4th through 6th at the Hyatt Regency in downtown Boston. This event will focus on the concept of provider-payer convergence, as this market trend continues to pick up steam in the face of healthcare reform initiatives. You'll be able to see us contributing to the market's understanding of this trend throughout the year as we continue to follow this and publish reports tracking the progression of new business models and new technology stacks that are going to enable a better flow of information between various stakeholders in healthcare. Care management will feature prominently in these discussions as we continue to see a shift from payer-led care management to more of that responsibility falling to provider organizations. I will include a link to the event website with a follow-up email. Without further ado, I leave you in the capable hands of Matthew Guldin.
Thanks, John. Just wanted to walk through today's agenda for the webinar before discussing a little bit further. We'll be going through a brief introduction of what a care management solution is for the provider market, as well as discussing some of the brief differences between care management and care coordination. Next, we'll just go through a current state of the care management market, discussing some overall trends in the marketplace itself, including adoption, as well as partnership and buying activity. We'll then discuss the vendor landscape, including some of the vendors that were in this current market, as well as current trends and things that we looked at in the report in terms of evaluating these vendors. And then lastly, we'll close with a summary in terms of concluding thoughts on this marketplace and its future outlook. Just want to go through a brief introduction here in terms of what a care management solution is. A lot of variation when talking to vendors and providers about what they would define as a care management solution. We had about 13 to 14 different attributes that came up when really looking at what a care management solution should be. The core characteristics that came up in just about every conversation were the following five. One, these applications have to be patient-specific and have to incorporate the characteristics that are relevant for this patient, i.e., what diseases this particular patient has, what's been their recent medical utilization, and other relevant factors that are specifically attuned to this patient's individual needs, both in terms of services and other needs to improve their health. Next, we have a coordinated care plan. This essentially is basically one step further than the standard treatment plan that comes out of a physician or doctor's office visit, and essentially incorporates not only the services that a physician or specialist might provide, but other members of the care team themselves, as well as the goals and tasks that are assigned to the patient themselves or the patient's family caregivers. Next, this is integrated with clinical care activities in terms of the coordinated care plan and go hand in glove. That the activities that are assigned to the care team, including the patient, family caregivers, or other members, are closely integrated with the coordinated care plan so that those those tasks can be tracked in unison, and the progress towards meeting those tasks can also be looked at by the individual who is coordinating the care for this particular care plan. Next, they're collaboratively developed. This not only means that the physician and the patient have input into the care team or into the coordinated care plan, but other members of the care team, as relevant, have the ability to provide updates and provide feedback in terms of how things are progressing with this patient as they work through the individualized coordinated care plan. And then lastly, it's evidence-based. This is somewhat of an emerging area as it's taking traditional evidence-based medicine content, which was more along the lines of a clinical guideline or a clinical pathway, and really taking that information and putting it into a patient-specific context within the confines of a coordinated care plan, the tasks, the goals, tasks, and interventions that you find within the care plan. Those are the 5 core common elements that we see within each care management solution today in the marketplace. Wanted to talk next about the differences we're seeing in the marketplace between care management versus care coordination. And this is a real key point to make in the marketplace right now. Care management is being defined as a more narrow focus versus care coordination, which is a broader focus. And we'll talk about some of the key differences that we have found in the marketplace right now. In terms of the primary responsibility in terms of care management, most provider organizations are still really leaving this up to a nurse care manager or the patient's PCP. When you get into care management, you're having a number of additional stakeholders coming to the forefront depending upon what ways care coordination is being employed and what settings of care that patient's primarily being seen, including their own home. So that typically includes a care navigator, might include a social worker or a home health worker, or other types of individuals. The number of clinicians in a care coordination role is a lot greater from what we've seen. In terms of primary workflows, another key piece of this here is that in care management, we're seeing a comprehensive assessment at the time of enrollment, a care plan, and then other types of functionality that we've used in this report to evaluate vendors. In care coordination, though, these solutions are being asked to deal with different types of workflows that are more broader, encompassing across different care settings. Instead of transition support, you have more full breadth transition management. You also have referral management. Increasingly, you have organizations trying to incorporate community resources, whether they're nonprofit or governmental resources, into their care coordination programs, and then other stakeholders. And then lastly, the information barriers are slightly different. In terms of care management, I still think that organizations are struggling to deal with just information overload, not only about getting data from the EMR, getting claims data and so forth, but really trying to make sense of it and put that into a care plan and then act upon that data. You're also seeing caregiver support. A lot of times, patients that are being enrolled in care management programs are having a higher disease burden. This might be a frail elderly population, might be a complex comorbid population, and a lot of times a significant other, whether it's their spouse, their children, whoever they are playing a critical and key role in helping that patient or that individual meet their care goals. And then lastly, just funding. The issue in terms of these programs, getting them up and running and getting them up to scope and really figure out what the return on investment is from a provider side has been really challenging. Care coordination, I'm not saying that those issues don't apply, but there's a slightly different set of issues that we're seeing right now in the marketplace. Engagement of the patient is a key one here. Health literacy is a key one here. And then IT interoperability, especially with the patient being seen in different clinical care settings and involving different types of organizations, both the post-acute and home health environments. Just go real quickly through the current state of the care management market, talk about some of the overdue trends that we're seeing and the dynamics in the marketplace. Just in terms of the market overview itself, adoption is really reaching a tipping point. It's really hard to get a hard and fast definition of how an organization is defining their care management / care coordination solutions right now. Again, you talk to one organization, they'll give you these 7 applications are being used for those functions. You talk to another application, you talk to another organization, they might be using 12 applications for those functions. there's a lot of variability in the marketplace in terms of what's being defined as a care management / care coordination solution. And a lot of these solutions have elements and pieces of those embedded in their functionality. In terms of what we defined, though, previously as kind of the core tenets of a care management solution, adoption was about 30 to 40% of provider HCOs in 2015. We've had some additional adoption from what we've seen over the past year, reaching the 40 to 45% mark in 2016. And we think that the market's going to really reach a tipping point sometime in the 2018 time period, where more than 50% of organizations on the provider side will have some type of core care management solution as we've defined. This is also starting to become a replacement market. You're starting to see leading HCOs, especially larger IDNs and larger provider organizations, really looking to replace older solutions that they had purchased several years ago, primarily that were registry oriented, had a heavy analytics function, and really were primarily focused on identifying and closing care gap opportunities within a particular cohort or group of patients. You're starting to see a further evolution of that into more of a codified care plan functionality to address this particular market need. Also, HCOs are slowly starting to consolidate some of their PHN solution, which includes care management and care coordination, but again, very slow process, and they're very reluctant to move off some of these legacy solutions. That's especially prevalent with some of the payers that we've talked to. And then lastly, just market inertia. There's a little bit, I wouldn't say a slowdown per se that I've seen with vendors I've talked to over the last 6 months or since the election, but I definitely think that a lot of vendors are kind of taking a wait and see type attitude with making additional purchases in this particular area right now, especially the providers or HCOs which have already not purchased a solution. In terms of what has stayed the same since the report from last year versus this year, definitely wanted to kind of highlight a couple of key trends here. The first one is that episodic care management reigns. Most of the organizations that we've talked to and the vendors also reflect that these solutions today are really being used to manage patients on a set time period, typically 30 or 90 days. And they're typically doing this and responding to the market incentives that are in place to manage these particular patients. We're also seeing little emphasis on engagement. There has certainly been some incremental improvement in terms of incorporating additional patient level type of functionality and engagement, i.e. self-management support in these solutions, but for the most part, the heavy period of assessment or engagement really happens upon the initial enrollment of the patient into a program through the initial assessment process. There is some additional follow-up with the patient, especially if they come in for a visit or they have some type of direct touch point with the provider organization or the HCO, but we're seeing a lot of sporadic engagement in between those more set utilization events. Lastly, ROI remains elusive. I still see a lot of organizations really struggling to come up with a valid comparison group for this particular program, and then what should the cost be in terms of really the numerator denominator calculations for this, as well as what patients should be included. Very difficult endeavor to undertake. The key takeaway here, though, is that we've kind of heard this again and again, is that focusing just on the sickest 3 to 5% of patients you have is not returning a positive ROI over the initial 12 to 18 months. Some providers are a little bit more opportunistic depending upon the contract type and the patient population that they can realize savings over a longer time period, especially if there's not a lot of patient turnover in that particular population. But it is very challenging to generate a positive ROI from the HCO, provider HCO perspective on these populations, focusing on such a narrow tranche of the population they serve. Again, also, what has changed? We're seeing more concrete strategies here really starting to shape care management workflows, whereas even, let's say, 12 to 18 months ago, I think a lot of organizations thought that they needed a care management program and to put that in place and respond to kind of the overall shift to value-based payment. Didn't necessarily understand or know how that was going to intersect with their traditional fee-for-service line management strategies, as well as kind of overall care delivery strategies that they have in place. We're starting to see a little bit more alignment with value-based programs and some of the care management and care coordination requirements in those, especially around the PCMH Level 3 certifications that NCQA just rolled out in their recent criteria. Also, they're starting to scale, albeit slowly. We're starting to see more patients being enrolled into these particular programs from the HCO perspective, beyond the complex comorbid populations, but again, still very challenging to scale these populations efficiently. Lastly, just around increased conversation around social determinants of health. That seems to have been a real buzzword at HIMSS. We've had a number of additional conversations since then, but the challenges really remain about how do you collect this information, and then more importantly, what is the utility of using this information within care management? We're just at the very early stages of both of those issues. Just want to walk through the vendor landscape real quickly. We're seeing a marketplace that has a little bit more clarity to it, but still very, very crowded and diffuse. We evaluated 60 vendors for this report, profiled 21 in length, talked to a number of other startup or smaller emerging vendors for this report, especially disease-specific vendors that we have some upcoming research on this year. In terms of the market itself, there still is a lot of enticement, and you hear a lot, at least from the investor or sell-side community, of vendors that are looking to get into this marketplace due to the overall size and opportunity that this marketplace presents. You've seen a couple of significant entrants in the past year, most notably Health Catalyst and Salesforce. We've seen EMR vendors, though, continue to make additional progress in terms of realizing that they need to build out additional solutions to their core acute and or ambulatory EMR solutions to address this new market need. They are increasingly becoming competitive. Each of the major EMR vendors that are in the marketplace now does have a product in this market area and a go-ahead forward strategy. There are a couple of exceptions, but for the most part, all the major ambulatory and or acute EMR vendors are starting to make progress in this area. In terms of the independent or best-of-breed vendors, they're starting to reevaluate their position a little bit. I think that since the market is so crowded, it's tough to stand out unless you have a specific niche or a specific focus in this marketplace. We've seen advisory boards, Zincs, and several other smaller vendors decide to leave this market in the past year for various reasons. And I definitely think that a lot of the independent vendors that are in this market are still going to have to kind of figure out where their niche and where their focus in this marketplace is going to be. Lastly, in terms of the solutions that have begun to differentiate themselves, we are starting to see certain vendors target different sets or different areas of the marketplace and also bring slightly different sets of functionality to serve those different populations or different types of opportunities. Still very early to see in this, but it's going to be very interesting to see, especially around some of the payer-provider convergence work that we're doing. Just wanted to walk through some of the changes in product capabilities in the marketplace itself and some of the differences that we're seeing in terms of why we decided to rate and evaluate vendors on the criteria you see under the 2017 categories versus the 2016 categories. This is primarily really due to the shift in episodic care management that we've seen in the marketplace, and that's why we changed some of the criteria from last year's report to this year's report. We put in external data sources, which is kind of a catch-all category, but focuses on the data that is increasingly being asked for in these solutions beyond the traditional EMR or claims data that's there. We talk about patient screening and assessment, and we have added that as a criteria in terms of how organizations and how these solutions are really handling the assessment of patients once they're enrolled into the care management program itself. And then self-management support with the realization that if organizations are going to effectively scale these populations and serve, let's say, chronic disease populations or less complex populations, but they're also going to be more automated and have more touch points, there's going to need to be increasingly additional self-management support capabilities added to these. Some of the pieces that we pulled out, or some of the criteria we pulled out patient assignment and management. That really focused That criteria was kind of rolled up into our program enrollment criteria. We pulled out evidence-based content, not necessarily because that's not a critical key piece of this marketplace. We just haven't seen enough differentiation in the marketplace right now among some of the vendors that are starting to fill this gap in the marketplace. So that was one of the reasons why we removed that. Risk identification, stratification, kind of the same thing in terms of really falling underneath the program enrollment. Everybody has ability to generate a patient risk score today. The value of that, or the utility of that, is really taking that patient risk score and making some use of it instead of just generating an overall risk score for patients that are enrolled in a care management program. And then lastly, we took out two other areas. Community-based referral management, because this workflow process is primarily being done and handled outside of these solutions today by a separate set of solutions in the marketplace. And then lastly, care gaps. We felt that the care gap functionality in these solutions is being handled by other types of solutions that are more open, primarily on an analytics focus or basis, as well as not being a core focus of this episodic care management programs that most organizations are engaging to today. So kind of what are the differences between the vendors in terms of where they align versus where they differentiate themselves? Every vendor today in this marketplace has an ability to identify and assess patients. Really, the difference here is how those patients are being identified, i.e., not just the ability to generate a risk score, but what are the differences in that risk score, and then how are you taking those patients, and what are the criteria you're using to select and identify those patients who should be enrolled and targeted in particular care management programs, as well as in the assessment itself. How are you handling the assessment process, and what are some of the solutions and techniques that you're using to both increase some additional efficiencies there, as well as identify the appropriate questions that should be asked to a particular patient. Create care plans with goals, tasks, interventions. Again, this goes back to that coordinated care plan concept we first mentioned. Every solution in this marketplace has the ability to generate a basic care plan with those classic elements of a care plan itself, the goals, tasks, interventions. The differences that we're seeing in the marketplace are really kind of the origin, i.e., how those plans are being generated through the assessment, and then also the variability of the care plans. What are some of the nuances in terms of how those care plans are being constructed, and some of the additional data types or fields that are being asked beyond just the goals, tasks, interventions. Communication care plan info to patients. Again, every solution out there in the marketplace today has some basic capability around this, primarily through patient portal, other means. I think what we're starting to see a little bit more differentiation on is really how these solutions are starting to communicate with patients and really moving beyond just kind of the traditional patient portal type of functionality. Last two are really monitoring patient progress towards goals. Every one of these solutions has the ability to manually update status towards a goal. What we're really starting to see some differentiation on is kind of two areas. One, the abilities in terms of how goal tracking status is progressing within the care plan itself, and as well as some abilities to increasingly automate some of these capabilities and automate that functionality instead of having to do this strictly through a manual intervention process. And then lastly, just altering care plan goals and tasks as needed. Again, very highly manually driven workflow today. There's a number of solutions that are out there in the marketplace which do have rules engines and certainly can bring a number of those to the forefront to automate some of this, but it's still a very highly manually driven process that is driven by the end user, almost in all cases a nurse care manager. What we're starting to see is a little bit of change in the extent of the engagement with the patients themselves and some of the self-management features that basically deal with the goals that are assigned to the patients themselves. That's another area we're starting to see some differentiation. Just want to talk about some of the shifts in the target markets we're seeing from the vendor perspective. The primary markets that everyone is targeting, IDNs, ACOs, clinical integrated networks, all have been stable over the last years. In terms of the secondary markets, medical groups, PHOs, IPAs, again, stable, but with the acknowledgement that certain vendors aren't going into that marketplace because of the price points that are the price points of solutions in that marketplace. We have seen really increasing area in kind of three areas. One, from payers themselves, from community service organizations, and then from some of the districts and Medicaid waiver initiatives. Those are really the three areas where we have heard that there's been a little bit more uptake in terms of RFP, RFI activity. Although they vary considerably, and on the community service organization side, they often come with a lot of caveats because a lot of that funding is grant funding or one-time type funding. We have seen a little bit of declining interest from a couple of markets. I was surprised by the self-insured employer market. We have seen a little bit of declining interest there, and I'm not really sure why that is the case. I'd have to delve into that a little bit more. And then lastly, from life science companies, med device companies, in terms of the vendors who were in this report targeting those areas, we've seen a little bit of a decline. And then the provider-sponsored health plans. They just haven't necessarily seen provider health and sponsored health plans being buyers of these solutions. That often is left to other individuals in the provider organizations to accomplish this. We're seeing no interest in several markets, post-acute, a lot of variability in this marketplace, and a lot of cottage-type industry still prevalent in that marketplace. Makes it very challenging to come up with the capital requirements. Even some of the larger organizations, Kindred just announced that they're possibly going for sale. A lot of flux in that marketplace. Standalone hospitals, again, just don't have the capital requirement to do this by themselves. Fully qualified health centers have kind of drifted out of this marketplace and really aren't focused on some of the care management / care coordination, and primarily just driven by dollars, the ability to generate additional dollars to pay for these types of applications outside their core EMR is a real challenge. Partnership activity. I wanted to walk through this very quickly in terms of where we're seeing additional partnership activity, because no one vendor can begin to address all of the functional complexities that are in a care management, let alone a care coordination solution. So the partnership types here are the ones that we see most prominently being mentioned by the vendors that we've talked to for this report. You see risk stratification come up time and time again. The importance obviously is very high, having capability. We haven't seen much additional activity in this marketplace. We've seen a lot of vendors kind of form their partnerships in this area. Hasn't been a lot of activity over the last year or so. Evidence-based content, though, is an area where we have seen a number of vendors form partnerships over the last year, since last year's report, as well as vendors kind of enter this marketplace, most notably XG Health Solutions with some of the partnerships that they formed. And then lastly, there's just a couple of additional partnerships: clinical terminology, provider communication, data visualization, patient and drug data, that we've seen vendors add, but not necessarily focus on. I'd say primarily we've seen a real focus on the clinical terminology and, the evidence-based content and the clinical terminology over the past year in terms of partnerships being formed. And lastly, just in terms of the partnership activity itself, we have definitely seen a slight uptick in this, but I think one of the key concerns that we've heard from the vendor community as well as providers is that adding some of these solutions and capabilities would be a nice to have, but it adds an additional price point to the solutions. And provider HCOs are already very price sensitive for these solutions. Adding an additional 10 cents, 20 cents, 30 cents PMPM for these solutions and additional functionality areas is a real concern for a lot of provider organizations we've talked to, and I think that is going to be a slight hindrance on some of the broader provider activities in this marketplace moving forward. Top challenges for vendors, walk through these very quickly. Short-term challenges really are over the next 12 months. Veracity of the data, just kind of cleaning up the data and classic ETL related issues in terms of bringing the data into these solutions. We've heard varying reports from vendors and the providers themselves that 20 to 40% of the product's resources when these projects are first announced is just really just dealing with the data issues themselves, not only connecting the EMRs and getting the claims data, but also just making sure that the data is be able to be used by these solutions. And they're sucking up a lot of resources, especially at the initial outset of these programs, and even on an ongoing basis. Integrating claims and clinical data is still a real challenge. We've seen some progress on this from vendors, but it's still a considerable challenge in the marketplace. EMR-centric thinking from a lot of provider organizations. There's certainly a segment of the marketplace. I'd say it's hard to quantify 20, 30, 40% of provider HCOs that seem very inclined to stick with what their EMR vendor is doing and offering. And that's something that we've heard, at least that I've heard time and time again, that there's a lot of organizations that are still thinking about, okay, how can I make this care management application work with my EMR solution more directly? Physician engagement is still a real problem. I think that these programs are being headed by nurse care managers, other individuals, might be headed by PCP engagement, but in terms of, again, how do you fund these programs? What types of additional responsibilities are you putting on PCPs who are already overburdened, classically underpaid versus their specialist comparison, their specialist brethren is a real challenge. And then marketplace inertia, which we talked a little about earlier. Moving into the long-term challenges, in terms of near-term challenges, integrating additional data types. We talked a little bit about that earlier, social determinants of health, other forms of data out there in the marketplace. Keeping pace with CMS programs, this has been a constant complaint from both providers and vendors in terms of just variability of the programs being launched and the care management or care coordination requirements within these programs not necessarily aligning very well across what CMS is doing, let alone other types of private initiatives in the marketplace has been a real concern. Immaturity around care delivery redesign, really taking these solutions and really moving from an episodic to a longitudinal care management perspective is a real challenging undertaking. The solution might get you part of the way there, but it really is going to be more of an operational and strategic issue to refocus on what this organization is doing and basically bringing the appropriate resources to the forefront from the provider side. Huge challenge. Interoperability API support, we're starting to hear some inklings of this, still haven't seen any specific use cases today yet around care management per se in terms of API support. I do think that there will be a couple of use cases that are emerged sooner than later in this particular area, but it is an area that's going to be very interesting to watch, especially the ability to support API capabilities for the care plan functionality itself, and then being able to distribute that across different care team members. Supporting additional user types and use cases, this goes back into the issue of moving from episodic to longitudinal care management, where you're having in care coordination just more user types that are out there and additional use cases. Again, it adds and requires additional sets of functionality being added to these solutions. Long-term challenges, really building an end-to-end solution. Eventually, the care coordination / care management functionality should come together. The reality is they're two different sets of applications in the marketplace today, but we're ultimately going to think HCOs are going to ask for more end-for-end solutions, taking that 8, 10, 12 number of solutions that are being used for care management / care coordination, even population health, and really building that down to 2 to 3. Disruptive upstart competitors. You see this in a lot of the niche areas. Referral management's a great one where you see vendors that are coming into this space to try to fill some of the lacks and gaps that are in the marketplace, as well as some of the disease-centric focus. Diabetes is a classic example of this, but there's several others that you see disruptive vendors coming into the marketplace with new approaches and new technologies. Conflicting regulatory requirements, talked a little bit about this with the CMS programs, but these organizations are increasingly requiring care coordination, care management. You see this in a lot of Medicaid programs and Medicaid reform efforts that are coming out. But again, it does not necessarily align well, especially the Medicaid programs, with what CMS is trying to accomplish. It's really challenging to create a care coordination program when you have 5 or 6 different flavors of that being imposed upon you by different payer types. Ownership of workflow processes. This is a really challenging issue in terms of really what should be under the domain or purview of the physician, whether it's the PCP or the specialist, the nurse care manager, nurse care navigator. Again, not really well defined right now in the marketplace. So I think that's going to be a real challenge for organizations as they reorient their care redelivery design. And then lastly, scalability. Just having these solutions really start to scale, tens of thousands, if not hundreds of thousands in theory in terms of patients that are served by these HCOs is going to be a real challenge with the resource constraints that a lot of HCOs have. Just going to want to wrap up here with a couple of key points around the summary in terms of where the marketplace is at, and wrap up with concluding thoughts. Lastly, there's really no all-in-one care management solution. We talked about very early about what are some of the differences that we're seeing, between a care management solution versus a care coordination solution, about some of the different functionalities we see between the two and the criteria that we use to evaluate vendors in this marketplace. In terms of moving to that all-in-one solution, it's not going to be there anytime soon. I think even in 5 years, if there is a comprehensive end-to-end care management solution that really addresses the 18 to 25 functional requirements you could get out there, would really broaden this out into a full-blown care management, care coordination solution for provider HCO. That's a very aggressive goal in terms of reaching that. Slow shift from episodic to longitudinal care. I definitely don't think that this is going to change over time. Depending upon some of the reforms that are in place and some of the requirements around those reforms, you might start to see more shift to longitudinal care. But unless there is a capitated contract or a payment mechanism that specifically encourages more longitudinal care, organizations, especially provider HCOs, are going to respond to this as you'd rationally expect in terms of addressing readmission or other more tactical concerns in terms of episodic care management. And I think that'll continue to be the case until either there's a significant amount of their overall payment that's in value-based payments, but more specifically so, that's more of a population-based payment model with true downside risk. For providers, automation is a hard sell. These solutions, if they're going to scale effectively, need to automate more. The problem is kind of taking the hands off the steering wheel a little bit and not relying upon the nurse care manager to really intuitively, with their experience and their knowledge, to utilize these solutions to heavily work through and not only rely upon their previous clinical experience, but also heavy manual data entry. That's going to have to shift if these solutions are going to scale effectively. The question is, what types of tasks should be automated and how quickly your organization is willing to do that is a real murky area. User experience must improve. A lot of these solutions, from what we've seen, have somewhat dated interfaces in terms of the way the information is presented, how it's presented within the longitudinal or coordinated care record itself, patient summary, and then also in terms of the care plan itself. Nurse care managers are managing increasingly larger population sets, although they're still relatively small. They don't have the time and energy to go into a new patient's record and really spend 15, 20 minutes, half an hour, really kind of going through with a fine-tooth comb to see what the issues are. That's one issue. And then just in terms of the usability and functionality solutions, they have to be able to support additional user types a little bit better than they do today. Lastly, making care management more proactive. This isn't only about assigning particular elements of the care plan to patients themselves and then just telling the patient that they should do this and supplying them with a link to patient education materials. It's really about providing them with stronger self-management support capabilities and providing them with a better way to communicate with their provider, and, whether it's a nurse care manager or other individuals. And this is a long-standing issue in the marketplace, is going to continue to be this, whether it's within care management or other types of programs or endeavors. Lastly, engage more in smaller doses. Really what we're talking about there is trying to figure out what are the most effective ways to engage with patients, and not necessarily sending out massive robocalls and automated IVR technology in terms of there's a screening for a particular care service and they need to do that, but just really figuring out what types of approaches work best with what particular patients. We're starting to get into some of that consumer science analysis, but really trying to hone in on that and figure that out a little bit more will certainly, hopefully, effectively improve these solutions, especially as they move to more of a longitudinal care focus. And then lastly, just to push it forward among political uncertainty. The issue of pushing more responsibility on the provider organizations, whatever under whatever rubric you call it, value-based payment, so forth, is going to be what happens in the marketplace, whether it's at the state level with Medicaid programs increasingly, or whether it's with federal programs and Medicare Advantage program and some of the other Medicare programs that are out there. There's increasingly going to be more responsibility pushed onto providers in terms of demonstrate value, but also more downside risk. And in terms of being able to address that, they're going to have to start to figure out where and how they do that with these care management programs and care coordination programs that they're putting in place. Just wanted to thank everyone for attending. You can definitely feel free to send me any additional questions at matt@chilmarkresearch.com. Just wanted to open it up now to any questions. Thank you.
All right, Matt. Thank you very much for that great presentation today. I will start with the first question that we had come in at the earlier side of the webinar, and it goes, why are the barriers such as patient engagement, health literacy, information overload, and caregiver support classified under care coordination, not also barriers under care management, and vice versa?
I think that there are also barriers under care management, but in terms of the more pressing barriers that we've heard under care management, given that the focus is more on episodic care management today, they're kind of down the list. Not to say that those aren't issues in care management as well, but there's different tactical concerns that the organizations are trying to address within the care management programs that they have today around the episodic focus. So that's how I address or answer that question. There's certainly issues, though, within those programs as well. But in terms of the care coordination issues, where if you're moving to more of a longitudinally focused care management program, those issues start to come to the forefront a little bit more.
Okay, thank you, Matt. The next question is, do you see any of the current smaller software vendors as potential disruptive upstart competitors for this market?
I don't necessarily want to speak to any particular disruptive, smaller vendor in the marketplace. That is going to be very interesting. One of my colleagues, Brian Eastwood's doing a little bit of research on that right now, looking at a couple of disease state areas, because we've certainly seen a lot of activities. Diabetes is a classic one where we've seen activities, but you've seen several other disease states where there have been vendors who have come into that. I do think that you will start to see 2 to 3 vendors in some of the more chronic disease populations emerge with different types of solution sets that do differentiate themselves in the marketplace. The question is, which of those disease states is that going to occur in, and how many of those vendors are going to have this, startup vendors are going to have the ability to raise the capital and really kind of stay the course a little bit, if you will. I think it's going to be a very challenging forefront. I haven't had enough of a chance to look into that marketplace, nor would I want to give my own thoughts on who I think is going to emerge as the vendors. I think that the opportunity, though, and even in the diabetes space and stuff I've looked at, you're going to have 2 to maybe 3 vendors emerge in that space, maybe 4, that are really going to scale and look to become more of a full breadth care management solution outside of that particular disease setting. But I think it's going to be a tough road for a lot of vendors that try and enter that approach, especially the ones that there is a lot of competition already.
All right, thanks, Matt. The next question is around looking at PHM as a service, but specifically, what is the role of consultants in addressing care management market needs?
This is a challenging issue, and one of my colleagues, Jennifer Rogers, just wrote a post on this that got posted on Sunday, I think, about some of the slowdown that we've encountered or heard from some of the consultants that are in the marketplace, and it'll be very interesting to see some of the Q1 results that come out from the health IT vendors that are publicly traded over the next 2 weeks, just to kind of see where the numbers are at and if that reconciles with what we've heard kind of anecdotally. I think that it's kind of twofold. One, it's the ability to address some of the limitations in the service offerings that a lot of the health IT vendors provide today. Most health IT vendors that we've talked to provide basic services in the marketplace around their solution and in a couple of additional areas, but really don't, with the exception of like an Evelyn Health and a few others, provide really a full spectrum or full breadth of outsourcing capabilities. In terms of what the providers offer, I would think that there's going to be an opportunity to fill in around specific workflow examples. Again, this is not my area of expertise, and I'm certainly not qualified to necessarily speak to it and without taking a further look on it. But I think it's going to be tough for pure consultancy organizations to provide kind of the classic services that they provide in the marketplace. I think a lot of times you're going to see provider organizations start to look and utilize the solutions and investments that they've made in these solutions and try and really figure out how to make them work and meet the additional needs of these emerging care management / care coordination workflows, which do variably considerably from organization to organization. I think it's going to be a real challenging place in the marketplace. And that might be one of the ways in which consultants differentiate themselves in really helping organizations figure out, okay, this is what a care navigator is, this is what they should do, this is what they shouldn't do, This is how you effectively build the care team. Some of the research and operations research that really goes into this, that might be one area which would differentiate themselves. But that, again, is more of a personal opinion than anything I've seen in the marketplace.
Okay, thanks, Matt. The next question is, what's the time period in which Chilmark believes automation will be a hard sell? Many clinics are already swamped today and really need some sort of care coordination solution now, not 5 years from now. So at what point will we actually have automation not be a hard sell?
I would think as my guess out is 18 to 24 months, maybe 36 months. And I think it's going to start around particular workflow use cases. This is one of the things I kind of poked around at a little bit at HIMSS and talking to a couple of vendors, more on the startup, smaller side that are focusing on this. The vendors that are in this space are really focusing on around specific use cases, whether it's new patient enrollment, whether it's offering text responses and generating responses to that, or whether it's an automated care assistant and talking to some of the solutions that are out there in the marketplace. I still think that that's going to be a tough sell for a lot of organizations who are going to get a lot of pushback from their chief nursing officer and others who really feel that they need a heavy tactical bent to this and utilize their employees to do this. The reality is, though, in trying to do that, they're not going to be able to scale these programs effectively. My sense is you're going to see that play out. If I had to make a time frame on this, I'd guess 24 to 36 months. It's not going to be 12 to 18 months because it's the incentives and pain points just aren't quite there yet. But you will start to see more of that pain being inflicted as MIPS and macros start to really come into the marketplace a little bit more strongly or are more strongly felt, as well as more risk being shifted to provider organizations.
Next up, do you see any significant penetration of CCM and TCM?
We wrote a piece on this last year. I tried to get this information from CMS, even filed a Freedom of Information Act to try and get the numbers of CCM enrollment. In terms of anecdotally what we've heard, I have heard that CCM enrollment finally has started to pick up over the last 6 to 12 months. When we looked at this last year, the adoption that we kind of cobbled together talking to vendors that are out in the marketplace was very, very minimal, even less on the TCM management side. I think organizations, though, and especially the vendors, have started to communicate this opportunity a little bit better to providers. Providers have started to realize that there's not as many barriers to gather that revenue. In a lot of cases, that revenue, I've seen consulting put out some things around this. I've seen several others put out pieces about how you use CCM revenue as basically kind of a leapfrog or a stepping stone to basically support some of the ongoing or startup costs to get these programs in place. I definitely think that will continue to pick up, especially this year around the CCM coding. I have not looked around as much around the TCM coding, but again, I think that will start to pick up a little bit more as there's an increasing orientation, the care coordination requirements in some of these emerging payment programs.
Great. So what is the relationship between care management and risk-adjusted populations such as Medicare Advantage, ACA, and Medicaid? Do you see providers and payers working together more closely on care management initiatives for these populations?
Again, some of my colleagues are doing research in this area and would be better qualified to do this. I've tried to talk to the payers and try to look to see what they're doing around some of the care management coordination activities that they're willing to offer to providers within the confines of some of these arrangements. I think the providers are very reluctant to uptake them, one. Two, and then there's a real question about, okay, who's going to fund these types of resources and what types of resources are you going to offer beyond kind of the classic telephonic nurse call-based center resources. I would think that, at least from what I've seen and kind of the anecdotal feedback that I've seen, the uptake has been very minimal in terms of what providers have been willing to uptake in these arrangements. And it's been a real challenge for providers to take the services that they traditionally offer, especially the telephonic-based services, and be able to move those over to the provider support. I don't have any hard and fast numbers there. I think that will start to change a little bit. Again, we're doing a lot of research in this area about looking for common platforms and technologies that will support that around the payer-provider convergence area. But again, I still think that it's too early in the marketplace right now in terms of being able to get payers to robustly support that for two reasons. One, they don't have the IT infrastructure to support it, and two, the solutions that are out there in the marketplace are not necessarily attuned or focused on addressing those needs or meeting those needs.
Okay. When it comes to specialties, will large HCOs look for all-encompassing care management solutions or specialty-specific ones?
That is the $64,000 question. I think that there will be, I still think that the overall care management solution is going to be what most organizations go with. The question is, what disease states do they feel that are, there's enough pain on them and enough opportunity to take market share that they're going to be willing to dabble in some of these specific disease-centric focused solutions. Whether it's a very unique population, they might be willing to dabble in them. I still think that predominantly, though, they're going to look for a care management-centric focus, and really, they're going to be willing. That's where they have made their investments, where they're going to be continuing to want to make their investments. It's going to be really challenging for them to make additional incremental investments beyond that and scale that. And that's also, again, creating a separate work stream and workflow. Why are you going to create and buy a solution necessarily that is outside of your kind of standing care management solution, unless you're going to use that care management solution primarily for episodic-based care, and you're going to purchase a disease-centric focus and use that for more longitudinal care management for a particular chronic set of populations. The problem with that is a lot of your chronic populations, diabetes classic 1, have a lot of comorbidities with that, especially around cardiovascular disease. It's going to be very challenging and difficult to do that. So my sense is that organizations are going to continue to purchase care management solutions, and that the niche disease-focused solutions are going to struggle to get entree and sell into the provider market.
Okay, we have time for one final question. So what are you seeing is the tipping point from a nice-to-have solution that will actually push it into something that can be justified, that you can justify the cost for HCOs?
I think a couple of things. I think that in terms of, is there a solution out there in the marketplace that addresses that today? If you maybe answer yes or no, I'd say no. In terms of where that's moving ahead forward, I'd have to give that some additional thought in terms of the key criteria that I would look for in terms of that solution point. Again, I would need more provider feedback on this in terms of looking at that. But I think a couple areas. One, the ability to support additional use cases and additional use functionalities moving ahead forward is going to be really important. I also think the ability to have self-management support, the ability essentially to have these solutions be able to scale effectively and be able to support more patients is going to be a real key differentiator in the solution. Now, you can always defer back to that clinical rules engines and business rules engines can accomplish a lot of that. I think that they can to a point, but I also think there's a real limitation on what those solutions can do in the marketplace. Have I seen a solution yet that I think is really going to be the clear winner in this marketplace? No. And I think that it's a little bit fuzzy in terms of what's going to be the functionality, the key set of 3 to 5 functional elements that are going to really be the key elements in this marketplace, because it's a diffuse marketplace, and even from what we've seen last year, there's definitely been a little bit of a shift in terms of what vendors are focusing on and what the feedback we've gotten from provider organizations, what they're looking for. I still think that's going to continue to play out over the next year or two until you see a little bit more of a crystallization of really what a care management solution is as this market starts to really become a bit more mature.
Okay, I want to throw one more question in here. I know that we're pretty much at the 2 o'clock mark, so we need to wrap it up. But final question. How much effort will HCOs and payers spend on addressing social determinants of health? This is a pretty popular topic at HIMSS, so I just want to throw this in here right before we break.
I think that payers are going to be very reluctant to do this, and I think even ACOs are going to be reluctant to do this outside of direct technical concerns, i.e. transportation being a key one, because there's a bottom line impact to the provider organization, and a couple of other key use cases where there's a bottom line financial impact to the provider organization. I think outside of that, it's a nice to have. I've just started looking at some of the solutions that are in this marketplace. We have seen a couple and several start to put out community resource directory within their solutions that list these varying types of organizations, but I think a lot of that legwork is still primarily going to be left up to the provider organizations themselves. I don't necessarily see payers being willing to invest in this. And then the other challenge with this is that a lot of the funding that's used to support these types of initiatives, again, it's very one off type funding, grant funding, other types of philanthropic endeavors come with a lot of strings attached to, especially on the philanthropic side with private charities. It's going to make it very challenging, I think, for a lot of organizations to be able to really effectively scale and collect these collect this information from the patients themselves, but also figure out what types of organizations they work with in the community outside of the kind of long-standing issues they've had with patients and some of the financial bottom line impact. Transportation comes to mind right away just because of some of the issues that provider organizations have in terms of paying for that, especially hospital-based organizations. But I think it's going to be a very slow and challenging process unless there is a direct program requirement, especially from some of the state Medicaid programs that are out there. I haven't seen CMS programs put enough emphasis on that in terms of direct collection from that data and monetary opportunity to do so.
All right, thank you, Matt, and thank you everyone who joined us and submitted so many great questions. That was fantastic. Really look forward to our next webinar, and be on the lookout for the follow-up email, which will include a copy of the slides as well as a link to our YouTube channel where you can view the recording when it is ready. I hope everybody has a fantastic rest of your week. Look forward to seeing you on the webinar next time.